Hello, friends. Good morning. This morning, we're going to just look at epidemiology and public health. What are the definitions for epidemiology and public health? Now, epidemiology is defined as a science, is a medical science that involves the gathering of data that relates to what we call or what we refer to as health related events. So, a study where we take our time to understand the causes, the distribution, that's the spread, and the determinants, which refers to the risk factors of health related events, is what we call epidemiology. So it's a basic part of the medical sciences, and it's important. It's very core and important to public health. It's core and important to public health because epidemiology provides us with data. It provides us with inferences. It provides us with conclusions for which policymakers and other government organizations can make use of this data to carry out all their different functions. EPID is core to what we do in public health. And we know that when we talk about public health, we're talking about health of populations. Medical science, clinical, or let's say clinical science and clinical practice, we can see is geared towards the individual. You visit the doctor, you see the doctor, you complain, and then they diagnose whatever is wrong with you, give you medications, give you treatment. That's what clinical care or clinical practice does. But when it comes to public health, the interventions are targeted at the population. So you want to have interventions that take care of population of lung smokers, population of smokers, people with lung cancer. And when we say population, we are not talking about just geography. Geography is one of the ways of defining population. Location is one of the ways of defining population. But when we talk about population in public health, we talk about a group of people bound by a common thread. There's something that binds them together. Of course, that thing can be location. But when you have, for an example, women or girls that are experiencing teenage pregnancy, for an example, that's a population. It's a group of people that are bound by teenage pregnancy. If you have diabetes, middle-aged men or older men suffering from diabetes, men over the age of 60 that are suffering from diabetes, they constitute a population because there's a common thread, there's something that joins them together. So when it comes to public health, we don't look at populations in terms of just geography alone, and this is important. There are history of how epidemiology came to be, especially how public health and epidemiology came to be. It goes dates as far back as the work of Hippocrates, uh, who is looked at as the father of modern medicine. So he also played his role in the development of epidemiology. We'll do another video where we'll talk about history and development of epidemiology. Stay tuned. Remember to like our content, share our content, and have a wonderful day.